Okay, I think we're going to start our session, and hopefully more people will be joining us during the introduction. I would like to start by saying that we're very excited to have this session as the closing activity of day 2 at the U21 Health Sciences annual meeting, because we have had an extraordinary day of presentation and discussions, and now for the closing activities, we're going to be doing a very strong activity with the Teaching Excellence Award workshop. As you all know, the Teaching Excellence Award was set up to celebrate and reward exceptionally educational scholarships, particularly amongst research-intensive universities, to recognize leaders and share the good practices across the health sciences group network. The award also promotes international cooperation by offering faculty from different universities and regions to work together on exciting and interdisciplinary projects, such as exemplary faculty members that I have the honor and privilege to present. Here with us, we have the Teaching Excellence Award 2020 recipients, Dr. Sheila Harmos from Lancaster University and Dr. Norman Ng from the University of Queensland. And I'm going to read a brief bio from each of them. Dr. Sheila Harmos from Lancaster University in Canada is an associate professor and associate chair in education in the Department of Psychiatry and Behavioral Neuroscience, Faculty of the Health Sciences at the Lancaster University. Dr. Harmos practices as child and adolescent psychiatrist in Lancaster Children's Hospital with a focus on general outpatient care. She is actively involved in the supervising undergraduate and postgraduate learners, as well as teaching within the Faculty of Health Sciences. She is an active member of the Psychiatry Exam Board for the Royal College of Physicians and Surgeons of Canada. She also directs a global mental health initiative in the department, which includes leading a long-standing collaboration and novel education initiative with the Western Uganda, where she also serves as faculty. Currently, she's focusing on enhancing educational scholarship activities across the department. She's particularly interested in thinking about medical education using psychodynamic concepts as well as applied to learning to understand educational phenomenology that are both relevant and present in contemporary medical education. Alongside, we have Dr. Norman Ng from University of Queensland, Australia. He's a lecturer with the Faculty of Health and Behavioral Sciences at the University of Queensland. He received his PhD from the School of Human Movement and Nutrition Sciences at the University of Queensland in 2009. Norman has a background in physical activity and health, particularly the role of physical activity in managing chronic disease, such as type 2 diabetes and osteoarthritis. His research interest includes physical activities measurement and occupational sedentary behavior. Norman is a senior fellow of the Higher Education Academy and has contributed to both undergraduate and postgraduate programs across the range of courses and various learning settings. His scholarship of teaching of learning includes active learning in higher education, interprofessional teaching, and learning in virtual learning environments and digital spaces as professional identities of allied health students. Norman is an inaugural lecturer in interprofessional education at the University of Queensland and the course coordinator of a large blended interprofessional foundation course with approximately 1,500 students. He is currently investigating the attitudes and readiness of first-year students toward interprofessional education and best practices in continuing and supporting interprofessional experiences for post-pandemic learning environment. The workshop title for this afternoon is Experiences of the Online Educator, Pandemic and Beyond. Along with Norman and Sheila, our audience is going to be reflecting on some of the questions that they are going to be posing precisely for this moment that we're living on online education, so not now during the pandemic, but what comes next. With you, and no further ado, Dr. Norman Ng and Sheila Harmos.
Thank you very much, Angelis. I'm just going to make sure that I will share my screen before I get into it.
There you go. We can see that.
Can everyone see? Am I sharing the right screen or is it?
No, you're sharing the one with the dual.
Okay, yeah, got it. Is that working? Is that the right screen now?
Yes, that's the right one, the big one.
That's great.
Okay. All right. Very good morning, afternoon, evening, depending on where you're actually zooming in for this session. Sheila and I are really happy that you're able to join us. It's a great privilege for us to be here to share with you on this particular topic that I think is really quite topical at the moment. The experiences of the online educator, pandemic and beyond. We also want to thank the U21 Health Sciences group for giving us this opportunity, obviously, to be with you today. And I really do hope that this is an opportunity and an avenue for us to basically come together as a community of educators to just share some of our experiences, some success stories, and perhaps some strategies for how we might better, work and operate within a digital environment such as this. So it's going to be pretty fluid, as you would know. I really did share with Sheila before that this is going to be not really a comfortable zone in terms of running an online and virtual workshop, but we'll do our best, and it's going to be really fluid. And I want it to be as casual as it can be, though. I think so that I think you've done really well in engaging with all the previous sessions already, and you're coming out to the end of the session and you want to let your hair down, in that sense. So let's do that. Okay, let's really do that. I also want to make sure that you have the link as well to the Padlet. I'm just going to put it in the chat box as well, that we will be actually utilizing Padlet for most of today's session as well. So I'll just perhaps maybe hand over to Sheila at this point for the session overview.
Thank you, Norman. I just want to echo Norman's comments. Thank you so much for joining us today. We know that people's time is really important, and asking people to join another virtual event really is a testimony to, I think, your dedication, and we sincerely are grateful for that. I wonder, Norman, do you think there's 24 folks? I think it's okay if we just kind of go around and just to kind of minimize some of the transactional experience of being in front of a computer. I wonder if folks would feel comfortable introducing themselves. If you're just comfortable saying your name and where you're from and what discipline you represent. Do folks feel okay with that? For those that have their cameras on, can I have a thumbs up just if people are okay with that? Be nice to hear from where people are coming. Great. Okay. So maybe we'll just call out folks according to the squares that we see them, faces instead of boxes. So my first square is Ricardo. Are you okay to introduce yourself?
Certainly, Sheila. My name is Ricardo Sandoval. I'm from Mexico City.
Great. Welcome. And Helis, do you want to introduce yourself again?
Actually, I don't think I introduced myself, so I'm going to take this time to do it. I'm Domínguez. I'm Associate Dean of Faculty Development at the School of Medicine and Health Sciences here at Tecnológico of Monterrey, and I'm very excited to be here with you this afternoon. Thank you, Sheila.
Great. Karina.
Hi everyone, I'm Karina Greenwood and I'm the U21 HSG Operations Manager based at the University of Birmingham.
Great, thank you, Karina. Next on my screen is Jesus Ibarra, is that correct? Did I butcher that?
That was excellent, Sheila, I think.
Jesus, I think you're on mute.
I'm Jesus Ibarra. I'm from Monterrey School of Medicine.
Welcome, Jesus. What background do you represent or discipline do you come from?
I come from medicine.
Great. Thank you for joining us today.
Thank you.
Thank you.
Right. Carlos Felix is next.
Hi, good afternoon to everyone. Thank you. I'm Carlos Felix. I'm from the School of Medicine, Tecnológico, Monterrey, from postgraduate courses or residency programs, and I'm a OBGYN. Thank you.
Great, welcome. Sylvia is next.
Hello, my name is Silvia Olivares. I'm the Academic Dean of the School of Medicine and Health Sciences at Tecnológico in Monterrey.
Great, thank you for joining us. Anthony Cox is next on my screen.
Hi, I'm Anthony Cox, University of Birmingham School of Pharmacy.
Great, thanks for joining. Stephanie, you're next. Maybe Stephanie's away from her desk. Daniela Muriel.
Hi, everyone. I'm Daniela Muriel. I'm from Monterrey, and I'm new in the Department of International Relations in the Health Sciences School in Tec de Monterrey.
Great, welcome. Alejandro. Maybe Alejandro stepped aside. No, I'm just going to see if I can get the name. Nomathem. I'm getting this wrong. It's only partially written. Are you okay to join and let us and introduce yourself?
Yes, I am okay to introduce myself. I am Nomathemba Nxumalo. Yes, I am at Eswatini, and I am studying with the University of Johannesburg. I am in the nursing field. I'm a community health nurse. I teach community health nursing.
Nomathemba, welcome. Thank you so much for joining us.
Thank you.
Rosa. Martha Parra.
Hello, hi. I am Marta Parra. I'm from Guadalajara, Jalisco, Mexico, and I'm a professor in medicine at the Tec de Monterrey School of Medicine.
Great, welcome.
Welcome.
Maria Luisa.
Yes, hello. I am Dr. Maria Luisa Valli. I am professor of School of Medicine at Monterrey, and I work on lifestyle medicine.
Great, welcome. Jose. I think it's Hernandez.
Hi.
Hi, are you able to introduce yourself?
Oh, yes. Good afternoon. I'm Jose Hernandez. I'm pharmacology teacher in the School of Medicine and Healthy Science in Tecnológico de Monterrey, in Monterrey.
Great, welcome.
Yeah.
Mary Anna.
Hello, everyone. My name is Mariana Cordero Diaz from Tecnológico de Monterrey in Monterrey City, and I am a professor, a teacher in the postgraduate medical education and coordinator of the Wellbeing and Professionalism program for residents.
Great, welcome. And I've seen, Mariana, that you may have a call, so we appreciate you being here while being on call for medical cases. And is it Aniela? Am I reading that correctly?
Yes, it's Aniela. I'm good afternoon to everyone. My name is Aniela Mendez. I'm also a teacher at University Tec de Monterrey in Monterrey. I'm also the chief of the director of the Department of Basic Sciences in the School of Medicine.
Great, welcome, Aniela. And lastly, I have Danielle.
Daniel Illescas. I'm from Mexico City, and I work in the medicine school and especially in the nutrition department.
Great, welcome, Daniel.
Thank you.
Did I miss anyone? Did anyone not get a chance to introduce themselves? Okay. So those who are just joining, I'll invite you to introduce yourselves on the chat line, because as you can see, we've got representations from around the globe and from very distinct and diverse backgrounds, which is really exciting, but also in keeping with the spirit of the health professions education background that the U21 award represents. So I'm just going to speak to you briefly about the context of our workshop today. And it really is recognizing our place and our role as healthcare educators, and that likely the pandemic has really changed our experiences in education. So specifically, Norman and I were spending time reflecting on the shift that has happened, namely that of moving to online education, which has happened for both of us, but also likely for many of you. And that this shift was a forced change due to the limitations of being in person during the pandemic. And so this forced change around the globe in some ways created a naturalistic experiment that Norman and I are both interested in and also somewhat concerned about as it relates to educator wellness, educator satisfaction, and even more broadly, educator mental health. So just briefly, today we're going to take a look at, in some ways, the collision between what the literature says and what people's experiences have been. So we're going to look at the literature about satisfaction and health profession educations from both the learner and the educator perspective, and to also understand the experiences for health professional educators during the pandemic. And then to think about how really has the pandemic affected educators and to think critically about educator wellness during the pandemic. Just a really quick note on methodology that Norman and I are going to rely on. Much of what we're talking about and what we're going to be orienting towards will be your experiences. But when we do reference literature, it's not a comprehensive review, but what we've tried to do is really in general, do a scoping review and then take samples from that scoping review to give you a sense of what the literature is talking about. Is that clear to people? Thumbs up if that kind of makes sense, what we're talking about today and what we're hoping to engage. Okay, good, thank you. Next slide, Norman.
Yep, so for those that have just joined us again, I just want to remind you that we will be utilizing this particular Padlet for our activities. And I'm also just going to put it in the chat again for those that have just joined us. And you can see that there are a couple of polls and there'll be a survey that we'll be speaking to about as we move along. So you don't have to worry about completing it at this point in time. Perhaps maybe after the workshop, you still have the link. You can feel free to actually complete that survey. But certainly when we get to the poll, I'll let you know when we want you to do that. Right?
Okay. Thanks, Norman. Next slide. So the first question that we really want to pose to you as a group, recognizing that we come from divergent backgrounds and from geographies, is to ask the following. Now we're talking about health professions, educations broadly, and the student experience. How satisfied do you think they were with online learning pre-pandemic? So again, we're thinking about the experience of the student pre-pandemic and really wanted to ask the question, how satisfied do you think they were with learning online pre-pandemic? So Norman, can you just instruct people how they can,
That's right. So if you look at the slide now, it says on Padlet, the Mentimeter poll number 1. So if you can just click on that poll number 1 in that column for the workshop poll, that'll be fantastic. We'll just give you maybe a minute to do that. This is going to be a little bit, let me try and find and share that screen now. So this is where the driver gets a little bit unhinged. One. Let me just.
Bear with us, folks. You can now already begin to see that this is symptomatic of our own mental health when we rely on technology to help us out.
So keep those responses coming through. Can people actually see the results of the poll coming up now on their screen?
Great.
So
Maybe
these,
we'll-
again, just
Perfect.
reiterating what you think in terms of satisfaction, how students felt about the online learning pre-pandemic.
We'll give folks just a few more minutes to try and orient themselves towards the technology. Norman, do the numbers indicate how many people have given their responses?
Yeah, so the numbers correct. So we have 10 responses so far.
Okay.
That have actually completed the poll.
Okay, so we'll give it a few more. Okay.
Great.
So we can stop the poll now and we'll just take a look at it. So on this Likert scale, we can see that the majority of people felt that students were likely slightly satisfied. Two folks felt that it was a neutral, and again, two, thank you for the votes that are coming in, felt that they were very satisfied. Now, this was with online learning pre-pandemic. Okay, Norman, are you okay to bring back the presentation?
So we're back to the presentation slide now.
Okay, so I'm going to tell you who's correct. You are all correct. In looking at the literature, the major perceived difficulty that students had before engaging online learning was that there would be a threat to social engagement. And in some ways, this is a reminder that the minds of students, many who are developmentally in their young adult stage where socialization is so critical to their development, that sense of developmental demand is also it's being seen in their learning needs as well. So they really wanted the opportunity for interactivity, and for them that meant good learning. Next slide. So this is what the literature would say. Students did report, back one.
Sorry.
It's okay. They reported increased satisfaction with face-to-face learning. However, when they actually measured in the end, doing empirical studies, there were no differences for preferences. And the interesting thing is schools have worked really hard to determine, does this actually make a difference with respect to learning outcomes? And several meta-analyses, and most of these are done looking at medical school students, say that there are no differences in terms of learning outcomes, test outcomes, exam outcomes between online and offline learning. A number of students indicated that they did have positive experiences, but it was largely moderated by their ability to be able to use the computer and use the online technology, and that they did find that there was an ability to come together for meaningful engagement. Norman, can you go to the next slide, please?
Sure.
But this, I think, is a take-home message that may be an oversimplification, but I think it helps us orient to how we teach. In other words, pedagogy, so how we teach, and when we're doing it online, the technology in order to deliver it to them matters with respect to their experience. And I'm not sure that would come as a surprise to most. But that's kind of the take-home message for how satisfied students were pre-pandemic. Okay, next slide, Norman. Okay, I now want us to turn our education to the educator experience. Now, when I listen to people introducing themselves, many of you are involved in undergraduate, postgraduate, and health professions education. So we now want to turn our attention to the online experience for educators in the pre-pandemic context. Next slide, Norman. So again, we're going to ask you to go to this Padlet and to the poll and ask the question, how many of you provided or used online teaching technologies pre-pandemic?
So once again, that will be poll number 2 on your Padlet. If you can click on that link there, poll number 2, that'll be fantastic. So I'll just bring up.
So let's wait a few more. And when we're talking about the delivery of online or the use of online education, we mean anybody who is using the internet for online discussions, online interactions, the use of teaching materials. Okay. Thank you, everyone, for giving your responses. So we can see that the majority of people who are joining us today already had experiences with providing online education in the pre-pandemic, with a good number, with 4 saying no, they weren't incorporating online technologies in teaching.
Okay.
Okay, great. Next slide, Norman. So this is where I want folks to really listen to what the literature is saying, because as we know, the literature doesn't always reflect reality. So when we looked through the literature and asked the question, what were health professions educators doing pre-pandemic? And this is as it related to online teaching. What we found in the literature was that there was a clear increasing mandate to provide online learning, and that people were adopting internet-based learning platforms, blended online, and that various methodologies and pedagogies were being used. What I think we can do, and maybe this is my psychiatrist brain as I'm kind of reading between the lines, I think universities are, there's an increasing need for income generation. And with the online platforms, there's more students can be reached and therefore enrolled. And I think it speaks to a fiscal environment that I'm sure everyone relates to, with a mandate to do more with the same or even more with less. So if we think about what was working in terms of online teaching, this is what health professions educators were saying. They were able to build online learning, but there really was a learning curve that teachers had to learn how to use platforms, and sometimes there were challenges related to it. They talked about specific pedagogical techniques that they could use, but that at the end of all of the readings and the literature on what was working, there haven't really been consistent conclusions about what effective online teaching methods were. So that would be the summary of what was working. One thing I will say is that educators really spoke. If you can just go back one slide.
Sorry, Sheila.
It's okay. That good educators knew what was working, and a lot of them talked about really just retrofitting good educational practices online, and that had both sort of positives and negatives. Next slide, Norman.
No problem.
Okay, what wasn't working? What the literature would tell us is that the introduction of technology for many of us as educators really introduced a silent co-teacher. And for many of us, that silent co-teacher could be friend, could be foe, could be enemy, or it could be both. And that was really an important experience to sort of register. I think one of the pieces that I would want to highlight here is that in this literature, the most commonly reported barrier was the technical challenge. In other words, there was a technical know-how that prevented teachers from engaging in the show-how, that they knew how to be good educators, and that it was really frustrating for many of them because they couldn't demonstrate what they knew because of the technical challenges. In terms of who is excluded, I think it's really important to recognize that there are our educator colleagues and students, particularly in sub-Saharan Africa and low-income countries, who have limited opportunities for online educational teaching and experiences for all kinds of reasons. Limited bandwidth, limited access to computer facilities, insufficient funding, and lack of infrastructure and expertise. So I want to actually stop here and open it up for anyone who wants to comment on this literature. Would you say that this reflects your experience as a health profession educator pre-pandemic as it relates to online teaching? Does anyone want to comment? And please just feel free to unmic or unmute and let us know your thoughts. Does this fit with your experience?
Yeah. Hello, everyone. And I would like to share that we are in a university that has been pre-pandemic, including even more online tools and education online. And that on one hand, on the other hand, not everyone was able, to adopt that. Even in you remember our previous pandemic of influenza, we have a chance to use then also our online resources. But that was a first experience. But I think that, yeah, we deal with some issues, technical, not working, or even the faculty, not everyone being able to use the technology. So I think that gave us a chance to take some previous steps these years before the pandemic. But I know that we had to deal even with that, with some difficulties at the beginning. Thank you.
That's great, Mariana. So what you're saying is that in some ways, the online platform highlighted learning inequities and that would ring true for you around the technical challenges. Thank you for sharing that.
Thank you.
Noma Themba, go ahead.
Thank you. Thank you, Sheila. I hope you can all hear me.
We can. Go ahead.
Okay, thank you. So I'd like to share what was happening in our university. As some of you may know that Eswatini is a resource-limited country. It shouldn't be, but it is, as we are in sub-Saharan Africa. So the issues of limited computer facilities and limited bandwidth is something that we would deal with frequently with our students. We were mostly using online education for our students that are distant students, like not on campus students.
Mm-hmm.
Then for those students, you would find that they are actually in the rural areas where internet access is limited, and some of them cannot even afford data, as in data
Yes.
for accessibility. So when you post work to do online, those that are in the city who can access such facilities would do the work, and those that are in the rural areas would not be able to do the work on time or submit on time until the window of submission has closed, probably, and then they would cite the problems that I've already cited. So they would then not be very open or accepting of the kind of of teaching that would happen online. So ours was a blended approach because we would then have also face-to-face classes. When they come for face-to-face, then they would be like, could we please submit the work that was supposed to be submitted online because the deadline came whilst I was still trying to access data. So yeah, we do have a problem in sub-Saharan Africa. Even now, okay, anyway, we'll get to that. Yeah, it is a challenge for us.
No, Mathemba, thank you for sharing that. And what I'm, if I just paraphrase what you're saying again, it sort of really accentuates the rural-urban divide that we know exists in education, but also that it created a sense of dissatisfaction and distrust for some students around using online education.
Yeah.
Yes.
Great. I'll move on to the next slide, Norman. Okay. Now let's talk about us and our role as educators. And here's my question for each one of you. Be prepared to vote from your own perspective. Health professions educators, how satisfied were we with our teaching portfolios pre-pandemic? Norman, are you okay to put up the Padlet link?
There is the link for the third poll was actually for another slide, Sheila.
Oh, okay.
Yeah.
Okay. All right, then I will, sorry, I thought there was another, go ahead. Can you advance to the next?
Sure.
So the results really depend on who you're asking, how it's being asked, what measures you're using, and when people are over asked. But overall, people talked about an overarching theme that most health professions educators loved teaching. They used effusive language, which we don't hear often in health sciences, but the words of the joy of teaching, I loved teaching, and that created a real sense of satisfaction. Now, if you read underneath, as the publications get closer to 2021, you see things like dissatisfaction, burnout, work-life level or work-life balance becomes an issue. And there are many criteria that are needed in order to make teaching satisfactory, like I need the skills, I need the time, I need to not lose income, I need to not be inefficient. So this was taken primarily from physicians, pharmacists, and nursing, but I suspect that that would likely be the same. Next slide. What Norman and I want to point out, I think, is a phenomenology that is really one that we wanted to talk about. This is a recent issue from The Lancet with a title called Physician Burnout, a Global Crisis. And you can see that it isn't pandemic related, but there is another crisis happening around burnout. And I'm not saying that this is necessarily directly related to education, but you can see that over time, the creep of burnout is coming into the experience of the joy of teaching. And I just want to see a show of hands for how many of you would that ring true? Either hands up or a thumbs up from your, yeah. I'm just going to scroll down. Anyone else where it would ring true? Yep, I'm seeing some thumbs up. Yeah. So the whole idea, again, that the literature base has largely reflected the student experience, and it really has paid very little attention to that of the educator, as though somehow those experiences can be separated. I'm now going to turn it over to Norman and to talk about educator wellness.
Thank you very much, Sheila. I think just keeping in with the theme that we have now shift gears and actually started to look at us ourselves as educators, as what Sheila has said, I think there's a lot in the literature about how students are feeling and how students are coping in terms of the satisfaction, in terms of actually moving and pivoting to an online environment. But I believe all of you can relate to the conversations that you have in your tea room, in your staff room, with your colleagues around how this new COVID norm has really changed the way that you do things. You know, the whole practice of teaching has changed, the whole practice of learning and utilizing digital technology, everything's really changed. So I just want to spend some time perhaps now just looking through at some of the evidence and what the literature is actually telling us about what the experiences of health professionals now during the pandemic, and what they have done to actually try and, I guess, overcome and to meet some of these challenges. So I think I'll start off just by perhaps sharing one of the projects that at UQ that was done. This was actually funded by a U21 research grant, actually. And it was a collaborative project between Lund University, Edinburgh, and Queensland. And at the end of, actually in the middle of the pandemic last year, pretty much towards the end of the first semester, what happened was obviously there was a whole big shift, and it was called emergency pivoting to online teaching. And the university was really concerned and wanted to know how educators or academics were typically feeling throughout that whole crisis in that sense. So what I've done is actually just taken out some tables just to give you, I guess, a snapshot of the findings within that particular report. And the report really just captures the change, from the perspective of the academic teaching staff in the semester when remote emergency teaching actually began. So this is around May and early June. And then what happened was they also, in addition to a survey that academics completed around June and August, there was a number of focus group interviews as well. So if you look at the slide, you can see that that's pretty much the demographic there. Majority of the academics that were surveyed were teaching classes of about 100 to 500 students on average. And what this figure actually highlights is the shift, during the emergency remote teaching, what academics had to actually do to try and engage students. So pre-pandemic, before COVID-19, I guess a lot of, the results here would echo with a lot of the institutions, that are represented here by us today. You can see that, the learning management system, which we use, Blackboard, we still utilize that. But you can probably see from that the online tutorials, online lectures, online practical classes, there was really a minimal before the pandemic, like that took over as the primary way in which we had to engage students. There was actually just no way that we could do that apart from actually just moving onto an online environment. And in terms of actually trying to facilitate students' interaction as well, the tools that were available to us and what we typically would use in a face-to-face or perhaps even in a blended environment, all those things had to change. So under social distancing guidelines, nearly all in-person activities were facilitated remotely. For example, 81% of the academics used on-campus peer-led discussions before, while 21% used the same approach, but operating online during the pandemic. So Zoom, obviously, their stocks skyrocketed because almost every institution was starting to use Zoom as the primary platform in which to try and facilitate student interaction during this, pandemic phase. And also the fact that I think peer interaction online, that was greatly reduced as well. That's what a lot of the academics echoed in this survey. And certainly from the literature, from what I'm reading, I guess, the sort of incidental learning that happens in a face-to-face format, that sort of like really was diminished under a virtual environment. So, reflections on teaching was a question that was asked during the survey and also during the follow-up focus groups for this particular study. And you can see this is data specific to UQ academics, that 38% felt negative, and some of the rhetoric and the words, the sentiment analysis, showed that majority of it was actually almost towards the negative spectrum. And further analysis of the perceptions found that 93 out of the 143 statements indicated that semester 1 in 2020 at the height of the pandemic was a very challenging time because of the very swift pivoting to an online environment. And I think many of us here can relate to that, like what we needed to do in that moment where we were given 2 weeks to quickly turn around all of your courses in a face-to-face format, to an online environment. It was something that none of us would envision that we would have to do within such a short period of time. So, I guess the words that came up, exhausting and stressful, but it wasn't all doom and gloom. There were some academics, obviously, when you framed it, you could see that these challenges were really opportunities to learn and upskill. So one of the statements that was drawn out from the focus group was that, well, it's tumultuous, it's uncertain, it's unnerving at times, but overall, a period of growth and learning in new technologies and approaches to delivery and assessment, which again, I think a lot of us here can now safely say that we have learned several new skills, or about several different tools that we would now use, as everyday pedagogical tools in our teaching and in our education practice. So this is the point where I think Sheila was referring to this particular poll that we wanted you to do. How would you describe your experience teaching during the pandemic? So if you can jump onto the Padlet again, and you can look at poll number 3. If you can just jump on there and actually have a look at that question and take a minute and reflect and think about what were the words or the phrases that would best describe your teaching experience during the pandemic. Just go stop sharing and find. Just give me a minute.
Thank you, Norman, for doing the technological turns, because I don't yet have my driver's license to do this.
It's a new challenge every day.
Mm-hmm.
But let me just share what our attendees are actually saying now about their experiences. So you should all be able to see that word cloud come up. Vexing, time-consuming, innovation. Great. So keep those responses coming. Soul destroying.
Soul destroying. The psychiatrist
Wow.
is deeply interested in that. How can you teach without a soul? Innervating. Isolating.
Stressful, excessive, time-consuming. Yeah.
Lonely. Zoom.
Yep.
Thank you, everyone, for putting in those really honest and raw responses.
Great. Well, thank you very much for sharing. And feel free to keep those responses coming. I'll put these slides up on, the results from our polls up on the Padlet after the workshop. But what I'll do now is actually go back to our presentation. Share. So, looking at the literature again, let's look at what were educators doing during the pandemic. Obviously, using a lot of new teaching methods, changes to assignments or exams, shifting to pass-fail. That was certainly something that came up, I know, in some of the courses here at UQ, where the rubric and your marking criteria had to change almost because you had to shift in terms of some of the learning outcomes and how students were going to be achieving them in a digital space. And some of that assessment strategy had to be modified, lowering the expectation volume of work for students. And we can really empathize with that as educators, though. I think in a digital space, everything takes longer to do. If you were able to deliver a lecture before in 20 minutes in a face-to-face format, that's now going to take 35 minutes, for example. You almost had to change the number of learning activities that you've got within your teaching or your curriculum, and even the expectations of how much students have to do. Technological support and literacy with online learning tools. There was a really interesting term that I came across while we were looking at the literature, and it was this term called techno stress. which is really, really, I guess, a very suitable and appropriate word, I think, to describe how we often feel when we have to do something online in a virtual space, you know. So I certainly still feel techno stress when I have to, for example, drive and navigate polls and, you know, sharing of screens and looking at the chat at the same time. And this transition is really, you know, challenging pedagogy. In terms of the reported outcomes and challenges, you know, we've mentioned diminished interaction with students. And I think a lot of you already in that poll that we did, you know, sort of like captured the results here that I'm showing you. A lack of confidence in online teaching. All of a sudden, for me personally, I felt I had to question my teaching practice. For someone who has been teaching in a face-to-face or blended format for the last 15 years quite comfortably, I almost had to relearn what I was doing in a digital space. And I certainly didn't feel comfortable doing that. You know, so the self-efficacy, you know, in terms of how effective you are in an online space, I think that was really one of the questions I had going through my mind. A need of assistance related to student support. So I certainly saw a whole upshift in terms of the kind of support that we needed to provide for students, you know, about their well-being, about their welfare, and how they're actually engaging with the online support there. And I might just maybe pull out one or two more from this list here to talk about quality of internet service and video calls. I think we've actually heard from some of our attendees here that was certainly more often than others, depending on where you're from, and I guess the access of the technology that you have. And it really exaggerated, you know, we've talked on that point. I think it's an important point there, the inequalities of educational opportunities there. It's really, really important there. And of course, there are tensions between the acceptance of e-learning and forced e-learning. I think if given a choice, all of us here would not want to pivot to an online environment within 2 weeks. But if you had, you know, a purposeful time, you know, committed to actually doing that, then I think the experience can be very, very different, you know, and how you feel about the whole e-learning environment, the teaching and learning space. I think that really affects whether if you had to do it in an emergency or whether if you're doing it because now this is the new COVID norm and you've got more time and space to think about it. So certainly those were the reported outcomes and challenges from that. So I really like this particular quote, and I think it sort of like summarizes a lot of what we have to do. You know, I'm not working from home, I'm living at work. Just even thinking about this workshop, for example, never before would I have to wake up at 5 o'clock in the morning to attend a professional development workshop in the past. Never would I have envisioned that I needed to do that. And now it almost seems like, you know, you have an 18-hour schedule to fit some of these activities in. So I think it's a really poignant quote for me, and something that I reflect on, thinking that those lines are, of course, and boundaries are very blurred now, but I think it's worth thinking that maybe we need to draw a line in the sand, you know, perhaps for our own well-being in that sense. This was something that I came across in one of the resources while looking at the content and looking at the literature, and some of you may be aware of this, you know, if we have any sociologists in the room. But the prismatic theory, I thought, was a really nice way of looking at our experiences as the educator. So in here, you can see that it's basically an analysis of lived experiences, you know, one of the books that I was looking at, and it identifies, you know, pitfalls, patterns, lessons learned from, you know, pandemic education. And it's quite an ethnographic sort of a research, but I think it has a lot of relevance to what we're trying to do and achieve now within our particular workshop, is to try and, you know, get a sense of this multiplicity of experiences from different people represented, you know, by the different institutions here, just to try and describe how we actually feel, you know, pre-pandemic, during the pandemic, and now what we seem to call it as COVID norm, post-pandemic sort of teaching and learning. So I leave this with you in terms of thinking of how you might want to frame your own experiences when you're trying to think that it's so interrelated with so many different dimensions. This is the last slide I have, basically, and I think it's a really nice paragraph taken out from one of the literature that we looked at. I might just read it out because I remember Sheila was telling me that it is something special when you actually read a particular paragraph out. So I'm going to do something and just read this out. The ongoing coronavirus pandemic has created an unprecedented crisis with global consequences. With relatively little warning, personnel in educational organizations, including PK-12 school systems and higher education institutions, abandoned face-to-face instruction in mid-spring semester 2020 and shifted rapidly to online learning. Educators were tasked with the ongoing coronavirus pandemic has created an unprecedented crisis and global consequences. Educators were tasked with maintaining relationships and ensuring quality while balancing student needs with their own personal safety, and for some individuals, simultaneously caring for loved ones and monitoring their own children's online educational progress. The transition to digital learning is but one example of the significant, ambiguous, and immediate crisis caused by the pandemic that has affected educational institutions, students, programs, and faculty, and staff, and those who lead these organizations. So to summarize, I think to say that we are probably still in a transition and learning how to do things better is probably rings true for all of us here. It took us decades to sort of like perfect the in-person pedagogical practice. And now having to learn that within 2 years and be experts of the digital space and the digital learning environment, I think it's probably going to take time, and that's going to evolve depending on technology, depending on our expertise, depending on our literacy with some of the technology that we do use. So let me just see what's the next slide. I think what we want to do now actually is I was really hoping to share some of the survey results that we have had that you can see on the U21 Padlet. Just looking at time.
We're doing okay for time, Norman. I think it would be really interesting to take that up.
Okay. Do you think it might be worth getting the attendees to actually try and complete the survey at this point while I try and bring out those that have already completed the survey?
Sure, we can just ask people to, for those of you that have not completed the survey, we'd really invite you and welcome you to complete the survey. It is quite brief, and while Norman is putting it up, it may affect our overall results, but I think you can go ahead and pull them up, Norman, and people can maybe complete them while you're doing it.
Yeah, so on our Padlet, again, there is a link for the survey, but what I want to do while you're actually completing that survey is to start looking for, I'll stop sharing for now. I'll find all the multiple screens that I've got at the minute.
And while Norman is doing that, what I would invite you to do is to think about your comfort level in sharing some of your own experiences. Just looking around the room, we know that females often are a larger proportion of those who deliver education, particularly in healthcare. And we know that females bore a very specific load in this pandemic as it related to family life. And I know that I speak to gendered roles, but that has been borne out in the literature, that women were called on to often be caregivers to their families, also to aging parents, to engage in their practice as health professions, meanwhile educating and faced with the need to remain safe and to to not become unwell. So if you can think about some of your experiences, and if you'd be willing to share with us some of your thoughts around the effects on your mental well-being, that would be greatly appreciated. And that's what we're really interested in, hoping to hear from folks after Norman puts up the results.
Yep. So I do have some preliminary data. We have 11 people.
Great.
I might actually just perhaps maybe speak to the results rather than show you the tables or responses. I'll just try and summarize it. So we've had about 11 people complete it. And in our sample so far, we have 7 men and 4 women who have actually completed it. So it's quite a different sample that we would expect. And again, we have people here from Monterrey, from Johannesburg, and the discipline areas range from education, pediatrics, medical, obstetrics, community health, nursing, midwifery, optometry, neurology, microbiology, sociology, primary healthcare, nursing. And in terms of how many years people have been in practice, they range anywhere from 1 to 30 years. A very, very broad range of expertise. In terms of number of years being an educator, we have, again, a really broad range there from 5 right up to 29 years of being an educator in this space. In the question about whether if you had to adjust your teaching practice during the pandemic, we've had majority of people actually, over 50%, adopted a hybrid mix of teaching in person and online teaching modality. And of course, we had 2 responses that pivoted to an online only teaching modality, and 2 people were actually not affected by the pandemic. We did have 1 other. And then in terms of overall wellness, question 6. So this is the one that we asked whether it was your overall wellness as an educator affected by the pandemic. So overwhelmingly, we're not surprised to see actually that almost all but 4 did not, their wellness was actually not affected. And in terms of whether if that was positively or negatively affected, we can see here from the results that it was actually mixed. So half of you felt that it was a positive effect of the pandemic, and half felt it was negatively affected there. So in terms of some of the professional impacts, like what Sheila was saying, if you're able to, perhaps maybe expand it later in our discourse and our conversation, we'll really welcome you to do that. But I will just perhaps maybe try and summarize some of the results that I see here in terms of describing one of the 2 professional impacts of this adjustments and transitions. So I've got a word here, promotion, that affected, I guess, a professional impact on promotion, the opportunities there. The amount of screen time, the lack of engagement, and the difficulty there in trying to get students to understand the content. I guess the lack of face-to-face. We're seeing that able to learn and teach online in a very urgent mode. The rise of telemedicine. Got a number more statements coming in. Longer working days and more work and more communication required there. Yes. Question 8, 1 or 2 personal. This is relating to personal impacts of the adjustments and transitions. Gaining weight, stop exercising, tiredness, stress, traveling, increase in anxiety. And I think this one, probably a lot of you can relate, those who are caring for kids and, helping to run the whole family at home. when the whole family works from home and children are learning from home, you have to balance between all the different roles that you have. And I think that's not surprising. Social isolation, some positive statements here about growth, personal growth. And again, yeah, fatigue and burnout, and I guess the blurring of work and personal time is one of the things there. And we did have one last question there, whether if you had any examples of sound solutions or fantastic failures from your experience as an educator. So I think that's really good. And you can also see that I've got a Jamboard on our Padlet as well, if you want to put anything up there as well. I think that would be great to share, in terms of how, what are the best practices around, trying to cope, in terms of our mental well-being during this phase. So that's pretty much all of the survey responses that I'd like to speak to. I'll just go back to our PowerPoint slide again. And I think, can everyone see that? Okay, let me try that again.
Norman, while you're moving over, Carlos has asked a really provocative question. Carlos, I wonder if you can unmute and tell us about the context for your question, and then we can maybe talk about it.
Yes, the question, what I meant is that everything changed. So the competencies and the objectives that we had, they changed. So we have a very difficult time to evaluate the students, the residents, because what we're supposed to get from them as clinical skills and competencies were different. So we are telling them that they got other skills with the COVID and different things, but how we could evaluate that. So I want to listen how you did to this evaluation, please.
Carlos, that is a brilliant question, because the pandemic really did press pause on all typical progression of learning evaluation as we knew it in postgraduate medical education. I'm happy to answer, but I wonder if others had experiences about how others tackled the idea of evaluating competencies and skills when the context was so dramatically changed. Does anyone else have a comment for Carlos? Just feel free to unmic. I think we've got associate deans and deans here. I'd be really interested in hearing from your perspectives around what you, how you pivoted around that question. Well, Carlos, I can speak from only McMaster University. It was exactly as you said. So there was, in some ways, there was an agreement that we would be very flexible with pausing the need to get a particular number of competencies or work-placed evaluations, et cetera. There was just enormous flexibility given to it. And in the Canadian side, they actually paused their accreditation cycle just to accommodate the kind of chaos that happened with postgraduate education, recognizing that there were lots of issues around redeployment where residents in one training specialty were moved to other specialties to meet the needs. Exactly. Yeah, so in some ways, it really wasn't fair for the learners. It was really all hands on deck. So there was, from our end, there's been a great deal of flexibility. What is interesting, I think, is yet to come is, are students going to appeal particular evaluations if they're problematic or if they're low? And then again, thinking about educator wellness, what kind of what's that going to be like for the educator to again manage those kinds of complexities. But I don't know if that resonates for you or if that fits with your experience.
Thank you. And if I can add something else, I think this was a very big challenge to give qualification or evaluation, because we have a meeting with the head of the teaching section from the government. He wanted to ask all of us if we were thinking that the residents were able to move to the other year, if they have enough complements of the qualifications or abilities, skills, or everything that they can promote for the next year. And we didn't have the answer. I mean, we did. Until now, I don't know if we were to be strict with the criteria. Probably we were to say no, but how would you say no, they cannot promote? And if on the other side, you say yes, they can, and say, which are your evidence, and how can you prove that? So until now, I don't have an answer. That's why I did the answer.
And Carlos, I'll add a little bit to your comment, which again is just so apropos. The same pressures happened in Canada, where the higher level folks who are involved in credentialing are asking, can you actually credential these learners sooner to get them into the workforce, to manage the crisis in human resources? And really it's the same issues that people were left scrambling to say, how do we actually say yes or no with any data to rely on?
Right. Thank you.
Carlos has, I think, done a great job of opening up the idea of questions or experiences. Does anybody else want to share their experience as an educator in the pandemic? Positive challenges? Just looking around. I just saw a hand go up. Go ahead. Aniela?
Yes.
Yes, go ahead.
Thank you, Sheila. It was very challenging for me. I felt very related to the image that I live at work now. It's like this division. I need to take care of my students, but I also need to take care of myself as a person. But I think I have managed to cope with the difficulties, but it has been very stressful and time consuming. I relate to that.
Thank you, Aniela, for sharing that. And again, I'm not sure, if we open that up for you, is that something that you feel is sustainable? Is that something that you feel hopeful about as we head into the fourth wave? Those are questions that I would want to ask. Angelis, you've got your hand up.
Thank you, Sheila. I just would like to complement first Carlos' questions about how we need to reflect upon the evaluation that we give to our students and the situation that he mentions, given that the situation changing completely and we have to shift our students to a different roles. And exactly it brought us to different kinds of reflection and seeing how we're going to assess or put a note saying they have the skills to complete their program. So it was very, very hard things to do. And I think it's not over yet because we haven't been out of the pandemic. We're like managing, right? And also, as Aniela mentioned, she talked about her role in the classroom as a teacher and also taking care of her teachers. She's also a director, but also of herself, her family. So this is this duality, or probably even more than one role that we have to play that is really, really hard to do. From the associative perspective in faculty development, we have been very well awareness, or we have awareness of the well-being of the professors, the teachers, And we implemented a survey precisely on trying to see what are what is the mental condition of our students, how they're dealing with the pandemic, a year and a half been through that. And it was very happy. I was very happy and surprised to find that there is, as in the togetherness, we are all in the same boat, but at the same, we are giving our hands to move forward. And there is hope, there is illusion that we're gonna be better. And we are taking advantage of what we have learned from this pandemic, not only keeping the worst part, the bad part, but also thinking about what we have learned and improving from there in our development. And now I'm finding that since we're moving into the hybrid mode, it's now harder to go back to the classroom because there are fears. There are things that we have already arranged in our home for our office at times, wherever, and now going back, is it safe for us? So now we have like these bubbles of safetyness in our own places that is harder for us to move back into the classroom. I don't know if I expressed myself clear.
Yeah, Angeles, I hear what you're saying, and I love the way that you linked everyone's comments. I think it really is, if we think that we're not related, so student wellness and teacher wellness, they are directly related. And it speaks to, I mean, and this is what I'm interested in as a psychiatrist, is that there is a deep relationality that happens between student and teachers, and the wellness of one depends on the other, you know, and we, I worry about the experience of loneliness for both the educators and the students, but I really like the way that you summarized the comments.
Yeah.
Any other comments or reflections based on what has been said? I'd be particularly interested in hearing from new educators, those that have been in practice for the first few years, as compared to those who have been doing it for a while, because I think it's been a quite different experience. Yeah, Carlos, go ahead.
Thank you. I will also add that we learned a lot of, and we were not thinking that we were prepared, because I feel like it was a war and suddenly we have an invasion and we have to react to that. So we are now doing and learning things that we didn't know that we were able to do. And we became very creative. And as we are trying to survive ourselves, but also the ones that we are in charge of as educators, we are trying to get the residents and the students to survive, not only personally, but also in their training. So I think that we have a very big responsibility, and we have been very brave, very creative to try to go ahead and do this, because now we are trying to do all what we learn or hear about that this afternoon about the learning online activities. And we were working a little bit, as we said at the beginning of the workshop this afternoon, but not as much as we are now. We are absolutely trying to do everything we can in this with this tool. And I didn't know that I could do things that I do now. I didn't know. So, and now I am looking forward to have more tools to do some innovations in the class, and trying to look forward to do this and to do that. And we didn't have that. We have a little bit, but not that much. That now we have that interest and try to learn more about how can I get better for my classes. And so that is something positive. I think that we have to do it, and now we are learning more about that. And probably with no COVID, we would not do it in that way or that much. Thank you.
Thanks, Carlos. Yeah.
Any last experiences that people want to share? Jesus, remind me, you were you obstetrics? Are you in obstetrics? Did I remember that correctly? You're on mute.
I'm on pediatrics.
Pediatrics, yeah. Would Carlos's comments ring true for you, or have you had a different experience?
What I would add is that it has been difficult to evaluate students and to assess their competencies, and it has also been stressful for me because my wife got COVID and my sister got COVID.
Sorry.
So it has been very stressful to manage teaching.
Yeah.
Because of their illnesses.
Yeah. And the context that you're responsible for to teach the residents is also happening in your own personal home. So there's just layers of complexity, but also stress that you can't really get away from.
Yes.
Yeah. Thank you. I think that was a reality that I don't know that, how could we prepare for that as educators, that there would be illness and stress from the pandemic in our own homes that would bear on us as well.
Yeah, that's right.
I'm aware of the time, and I'm just going to do one last scan. Anybody else want to comment? Norman, maybe if you just want to scroll to the last few slides. So even just to the next one, Norman and I'll start by saying just a profound and sincere thank you to Angeles and her team at the University of Monterrey, and to Karina for her support, but to each one of you, because you can hear even in these stories, there is profound commitment and respect for the practice of education, and there is resiliency, and there is also there's a cost associated. Thank you, Jesus, for sharing that. And I know each one of you have worked as educators in this pandemic, and I think on behalf of Norman, I thank you for being in it, because the truth of the matter is we really wanted to present data and a review of the literature that would talk about how we get through this and how educators can remain well. And that literature just isn't out there yet. We are living it and creating it as we go. And so in some ways, I think on behalf of Norman and I, this is a call to scholarship for each one of you to be committed to documenting your experiences as educators. But I mean, Carlos and Jesus, your comments about the evaluation challenge is real, and that resonates around the world. That could be a very interesting collaborative effort for us even to sort of think about a commentary paper, because that's not unique, I don't think. So just to say thank you to all of you for your thoughts. Thank you for listening to our reflections, for adding your own. And at the end of it, it's the human spirit. And as Angeles said, we are all connected. We are in this together. And that is the way forward for us. We do have our list of references for each one of you if you're interested. If you're okay, that's at the end of the PowerPoint. It's a lengthy list of references, but also our personal email addresses, which are also on the Padlet. We would invite each one of you to reach out if you'd like to continue the dialogue. We'd be really interested in doing that. And just again, want to say thank you. Norman, I'll hand it over to you, and then.
Yeah, so really thank you for sharing and those really personal and I guess raw stories that you've shared. I think all of us will say that we have a COVID-related story. And, you know, it is, you know, Sheila has put it, I think that the human spirit that really will continue to keep us going. And this is an evolving space. We all have to acknowledge that we don't have the answers, the solutions, the best practice frameworks, whatever, yet. But we are working through it, and we are living through that. And hopefully, you know, with this paradigm shift in the way that we do things within this COVID norm, you know, there'll be fantastic innovations that will come of this experiences, because we know that, you know, in crisis, that's where, you know, innovation and creativity are born out from. So we really hope that we will continue with our community as well that we have established here. And I just want to emphasize again about the Padlet. Like that link is there, and so feel free to jump on. And it would be fantastic if we can have a look at it from a year from now, you know, and see what are the things and where people are at, you know, in terms of the journey from here on forward in the next 12 months, what this whole environment might look like. I think that's going to be pretty exciting. And we'll put up our slides with the references, everything with the survey results as well on Padlet. So feel free to go back, bookmark this particular Padlet page. Yeah, it's been a pleasure, and thank you very much again for joining us. And Alice, back to you.
Thank you very much.
Thank you very much.
Sheila and Norman. I would like to ask everyone for a round of applause. I think it was a fantastic workshop. It was engaging. It was very, it brought us to the collective reflection and allow us to share experience of health professional educators from the perspective of the learning, the teacher, but also giving our own personal experiences and how we have been able to manage this chaotic period. And so I guess you truly deliver what the title of the workshop was, Experiences on the Online Educators from the Pandemic and Beyond. And I express the beyond because I think it was beyond what you did, the work that you put into the research that you done for preparing this. So I really congratulate you from your
Thank
work.
you.
And I would like to take a moment just to say that the winners of the Teaching Excellence Award 2021 will be announced next week. So we will have to wait for the results, you know that how it goes. And I also would like to extend the invitation for the day 3 of our U21 Health Sciences annual meeting. Tomorrow we're going to have court meetings, 3 more court meetings, and a cultural activity that is going to be mezcal tasting. Of course, that will be better having it in person, having tasting the mezcal, but at least you get to see or hear a person that is very well known on the tradition of this style alcoholic beverage that come from Maguey. And it will be fantastic if you can join us for the closing, the virtual faraway toast that we're gonna have tomorrow. So you have the agenda and the program, and I just want to thank again Norman and Sheila, Corina for their support, Veronica and the whole team, as well as the participants for today for being here with us. Corina, anything else you would like to add?
No, nothing really. Just congratulations to Sheila and Norman for a fantastic session. Thank you again.
Thank you.
Thank you.